we are so clued in as to what surgery you do that if you're doing a total knee, the management would be different from if you're doing a partial knee. So when he told me that he has been an active person and has realized that his muscle mass is good on his thigh, then I realized we can actually make him walk. And as I said, we tailor the anesthesia to the person. So what we did was to just give the right amount of pain relief for him to take over from that area which is the most painful part of the surgery. So we selectively block after the normal anesthesia that is given for replacement of the joint. In the post-operative period, we block the nerve that supplies the pain fibers to that portion of the knee. But it does not stop the muscles from working. Usually, the nerves supply both the muscles as well as the pain. We only block the fibers that supply the pain, so that you don't have the pain sensation, but you still have the strength to walk. It helps when borderline patients don't have much of muscle mass as you have described, and they cannot stand up immediately after surgery. Their muscles are already weak, and if you block their nerves which supply the muscles, they just cannot stand up. The muscles become flabby. So that is what we plan on, Dr. Pain is controlled either by giving oral medications or by giving local blocks. The techniques that we use is we image the nerve using an ultrasound machine, see that area and block the area, the specific nerve that supplies the pain fibers. So it also helps that during the surgery, at the end of the surgery, you put a lot of pain relief medication into the joint, and that takes care of the pain in certain areas, and we go ahead and block the other portions of the nerves which supply the area that is being operated upon. It also helps that when specifically this little unicomponent knee has been made, that you don't have too much of dissection. It's a small incision, and the pain relief to be given is comparatively less as to a large operation that is done for the entire knee. So planning the analgesia becomes better, and we actually, I think we involved you in the pain management. And
Yes.
we also avoid a lot of oral medications which like narcotics, etc., which will cause constipation, vomiting, and drowsiness after the surgery,
Yes.
which prevents them from walking fundamentally. And the next thing is that we avoid drugs which have got side effects such as non-steroidal inflammatory drugs. Call about ibuprofen, diclofenac. They have effects on the kidneys, they have effect on the GI system, they have effect on the heart, etc. Especially when people have other problems, we try to avoid those medications. So this method of analgesia is sort of a panacea to patients whom we can avoid these drugs with side effects.
Did you just give one block and leave it, or did you have some other methodology?
No, what we do is we picture the nerve, very selectively we leave a fine catheter next to the nerve, and we give the medication and keep on infusing pain relief around the nerve, so that the pain relief continues for a longer period of time.
With a machine that?
Yes, it's a machine which the patient can control, actually, which is a sort of a sterile infusing machine, which you fill the medication with a lower concentration so that it doesn't cause toxicity, and it can be controlled as to what the patient can. For example, just before physiotherapy, we'll increase the concentration of the medication.
Okay.
And we take it off after the physiotherapy is over.
Is this something which is done very commonly, or is this something very unique to you?
Don't think so. People do infuse medications, but they don't control it the way we do it, so that you can go up and down as the requirement is.
And so, Michael, when did you then leave the hospital after surgery? I mean, what were you told? How long were you told you will stay in the hospital?
I was told that I would be discharged soon, but I didn't know it was going to be as soon as 3 days. So when KP came to me
Or
in
even
the
less,
morning,
I think you were discharged in 48 hours.
36 hours.
There you go.
so he came in the morning and told me, he says, "What are you doing in the hospital?" So I said, "Well, I'm here, and do you think I can go home?" So he said, "Well, you're doing the same things here. You have pain relief, you have a television, you're sleeping here, you sleep at home, so you move." So I thought this was a very positive input, and I decided to take his advice and leave. So I had the whole setup fixed up at home. I had some support so that I could go to the bathroom easily. I had somebody coming in to look after me at night. My daughter and son-in-law were with me. So I thought this is a good time for me to move so that I can get independent sooner and start moving.
Right.
Because the movement is so important after surgery.
So you felt, did you feel that your recovery was as expected, better than expected?
Much better than expected. In fact, I never took any of the non-steroidal anti-inflammatory drugs at all during the period when the nerve block
You
was
mean painkillers?
Yes.
Yeah.
The nerve block was in. I never took any painkiller. I started taking them after the nerve block was out, particularly before physiotherapy.
Right.
About an hour and a half before physiotherapy, because that was a bit painful. And I do take them occasionally, but not on a regular basis now.
Right. So now 3 weeks down the line, you are pretty much pain-free.
Moving, I'm driving.
Excellent.
I took my wife out for a haircut a couple of days back. So people are quite shocked.
Yeah.
In fact, I met somebody at the club yesterday. Said, hey, Michael. Then I said, hi. So he says, didn't you have surgery for your knees? I said, I did. He says, okay, you walk back. So I walked back. I said, walk back a little more. So I walked back another 3-4 steps.
I mean, you were walking backwards?
Backwards.
Okay.
And then he asked me, okay, walk towards me. And I walked, he says, your walk is normal. I said, of course it's normal. I said, I have only 2 people to thank for it, and that's Dr. Udai and Dr. KP, who cooperated and got me better, because there were many people who were telling me that you need to go to different other places, and somebody is very popular, and somebody is saying.
I'm so happy to note that you've done exceptionally well, and this is what we've been noticing in our patients, that they're going home within 24 hours. I think purely because our recovery process is so well rehearsed now, and our physiotherapists are so well trained. They make the patient get up within a few hours of surgery, thanks to the pain relief that we are now achieving with the nerve blocks. And just yesterday, the patient was walking within 4 hours after surgery and was ready to go home that evening. But that's really encouraging. It's really good to see you back, and I'm glad to hear that you're getting back to your practice very soon, because the patients do need you now. So, thank you for coming and talking to us.
Thank you very much. Thank you for having me.